mynews.studio.
Imagine, just in 1 year, 1 million people are saved from a disease that's been with us for centuries. How did we reach this point?
It's December 12th, 2025. The World Health Organization released numbers from 2024. Malaria cases dropped sharply, 170 million fewer infections, 1 million deaths prevented. That's a major shift. So, what changed about the response this year?
Two main changes: the wider use of new malaria vaccines, RTSS and R21, and improved distribution of insecticide-treated nets. These were scaled up, especially in countries with high malaria rates, like Nigeria and the Democratic Republic of Congo. Malaria is still a leading cause of child deaths there, but with these tools, we're finally seeing those numbers steady.
Vaccines are a big leap forward. How do they actually protect a child? What's happening inside after they get the shot?
Both vaccines target the circumsporozoite protein, or CSP, on the malaria parasite. So when a vaccinated child is bitten by an infected mosquito, their immune system recognizes the parasite early and attacks it before it can multiply in the liver and spill into the bloodstream. That's the critical window. Stop it early and you stop the disease from developing.
But getting these vaccines to all who need them is still a challenge, right? What's getting in the way?
Funding, mostly. The annual need is about $8.3 billion, but last year, only half of that was available. That means shortages in supply and distribution. There's also the problem of weaving these vaccines into regular immunization programs, making sure every child gets all their doses, including boosters. That's tough, especially where health systems are fragile.
And it's not just about vaccines. You mentioned the nets. What changed with how they're handed out?
Distribution became more targeted. In 11 high-burden countries, local health teams and mobile malaria workers now use data to spot hotspots, places with lots of transmission, and focus resources there. It's no longer just blanket coverage. It's strategic.
Is that part of why more countries are being certified malaria-free? Georgia, Suriname, and Timor-Leste all joined the list in 2025. That brings the total to 47 countries and a territory.
Yes, that's exactly it. To get certified, a country needs 3 years with 0 local malaria cases. These results come from combining strategies: vaccines, nets, rapid diagnostics, preventive medicines, and active local monitoring.
But there's still resistance. Mosquitoes adapting to insecticides, for example. How do programs deal with that?
We're seeing new nets that use different insecticides, sometimes in combinations, and strategies like rotating which chemicals are used. Surveillance is crucial, tracking resistance as it appears so programs can adjust quickly.
What about lessons for other diseases, COVID, flu, or whatever comes next?
The main takeaway is that no single solution is enough. Layered defenses using multiple tools together are more effective. And investing early in health systems and research, plus making sure the most vulnerable can access interventions, is essential.
And involving local people matters. Health workers and communities deciding what fits best locally.
Absolutely. Local ownership and even local manufacturing help with costs and reliable supply. While science and international support are vital, it's people on the ground who make these solutions work.
Big picture, what does all this mean globally?
It's a turning point. Malaria has been one of the world's deadliest diseases, especially in poorer countries. Stopping 1 million deaths and 170 million cases in 1 year is historic. It shows that long-term, coordinated public health work really can transform societies, and it's a model for other diseases too.
The statistics are powerful, but it's also about setting an example. If it works for malaria, why not for other diseases?
It all comes down to our willingness to invest, to keep innovating, and to work together. That's the real lesson here.
Today we've seen how alignment between science, policy, and communities can set a pattern for global health progress.
Thanks for listening. This episode was brought to you by mynews.studio. You can try it now for free.